Honourable Speaker, my question without notice is directed to the good Prime Minister. Mr. Speaker, the government's Connect PNG program established under the Connect PNG Implementation and Funding Arrangements Act 2021 commits a 5.6% of the annual national budget to infrastructure development, equating to over 1.1 billion kina annually from 2022 to 2027. In 2024 alone, the transport sector, including Connect PNG, received 2.059 billion, representing 21% of the capital investment budget. Meanwhile, the health sector was allocated 1.7 billion for recurrent and additional capital investment, totaling 2.36 billion. Mr. Speaker, despite this, the reality on the ground is alarming. Our health system remains critically underfunded, with patients turned away due to medicine shortages, lack of hospital beds, and inadequate medical equipment. Mr. Speaker, it is widely known that health services in rural areas are collapsing. Yet the government has committed billions of building roads that many of our people may never use, considering the way the weather patterns have changed and roads keep deteriorating continuously. Last year, the National Department of Health faced enormous challenges. In the 2023 budget, the department requested 386 million, but received 236 million, leaving a 150 million shortfall over 12 months. By October, the situation had become critical. Funding shortages coupled with central bank delays in the approval of foreign exchange contributed to a visible shortage of medicines in nearly all health facilities. The country's vaccines budget was dropped by 25 million kina, forcing the department to seek urgent funding support from its international partners. Further, Mr. Speaker, the last publicly tendered contract for medical supplies was in 2019 or thereabouts, raising concerns that procurement is now being handled in an ad hoc and non-transparent manner and on an emergency basis. In 2022, Mr. Prime Minister directed Health Department to shift the procurement process to procurement processes with WHO-sanctioned manufacturers. Yet medicine shortages persist and hospitals continue to struggle and the primary health sector suffers every day.
We have a point of order. Minister, what's your point of order?
The good member seems to be talking about health matters, so is the question to the Minister for Health or the Prime Minister?
The question is directed to the good Prime Minister, because it covers two other areas as well. Mr. Speaker.
Honourable Member for Hearing Inquiry, you may go ahead with the question.
Thank you, Honourable Speaker. My question, therefore, are: 1. Mr. Speaker, how does the government justify spending billions on roads under Connect PNG when hospitals lack basic medicines and rural clinics are closing due to lack of supplies and staff? Number 2, is it true that the last publicly tendered medical supply contract was in 2019? And if so, can the good Prime Minister confirm whether we are operating on an ad hoc emergency basis? And if so, what measures will be taken to immediately restore transparency and regular procurement processes? Number 3, the 2022 directive to procure medicines directly from WHO-approved manufacturers was meant to improve availability and quality. Given the ongoing shortages, does the Prime Minister concede that this approach has failed? If so, what alternative measures will the government take to ensure essential medicines reach our hospitals and clinics? And why is Connect PNG receiving guaranteed funding while the health sector is constantly in crisis mode, scraping from resources to keep hospitals running? Finally, in the eve of the elections 2022, the good Prime Minister with the former Governor for Central Province launched a billboard project at Bautama for Central Province Hospital. And the good Prime Minister also confirmed or advised the people of Central Province when this project will commence and if funding will be allocated at all in this term of Parliament. Because, Mr. Speaker, and how much this year will be allocated. In the 2022 and 23 budgets, there was 50 million kina, and none of it was released. Mr. Speaker, the only occasion I've heard of Connect PNG funding being used for healthcare or connected to between was admission by the Works Minister that Connect PNG money was used for his urgent medical treatment overseas. I hope the Prime Minister can clarify this for the people of Papua New Guinea. Thank you, Mr. Speaker.
Honourable Prime Minister.
All right, Mr. Speaker, I may like talk thank you long, member long Hiri query. We'll ask him a good series of questions. And I am conscious of the possibility of me consuming a lot of time in this, but it's important for public conversation. It borders and digs into where is priority of government in expenditures, whether we are compromising health at the expense of other sectors like Connect PNG. So if I could ask for tolerance of this Parliament for you to give me at least 5 minutes or 6 minutes to try to dig into appropriate answers to respond to these good questions. But firstly, Mr. Speaker, just on a side note, I've noticed, and being around since 2007, that we are losing decorum in this House, especially simple things in the ethics of how we stand up. Mr. Speaker, need not lecture you. You know it better than I do. But just some basic things. For instance, when a point of order is raised, you are entertaining that point of order. The person on feet is supposed to sit down. When you make your ruling, then he stands up again, instead of him responding straight on his feet. So these basic things, and you should also remind this House that this Parliament has certain decorums. This is not a club. This is not a social place. This is not a place of loud noise. I think these sort of conversations need from the chair. All of us need to be refreshed on decorums in this House and basic ethics. So I just thought I reflect this, but not to take the light away of from the good questions that was asked. I want to confirm that Connect PNG has security of resource envelope. 5.6% of every year's budget is geared towards assisting in us opening up all parts of our country that remains isolated from each other. For instance, Port Moresby remains one of the most isolated nation's capital in the entire planet, unreached by over 85% of the country's population. And so, do you keep it isolated forever? This is the nation's capital. But of course, cognizant to the fact that we need to do it properly, with responsibility to security of the nation's capital and the adjacent people and provinces. I want to give assurance to this Parliament that at no time do we intend to use Connect PNG, for instance, to be priority over other relevant sectors, like health department or education for that matter, or any other allocations. I want to give assurance to this House through this question. The final budget outcomes that Treasury releases every year is on record. It's on record from Treasury. If all of you are asked, and Treasury by law is required by 31st of March each year to also furnish the report on expenditure of last year. The government spending is there on record for everyone to see, the total disbursement to each sectors. And we don't deliberately try to sabotage fund meant for health. Fund meant for health must go to health and has been going to health department. This Parliament does approve the expenditure plan of governments. Just like that, this government for the last 6 years, funds have been approved. And the sectors concerned, planning department, finance and treasury, in liaison with the sectors concerned, work in the disbursements each financial year. And so disbursements has been taking place. I am not equipped right now with the actual disbursements from Treasury, Finance and Planning to the Health Department, but I could give assurance that we don't compromise Health Department and Health Sector Fund. Health Sector Fund does go, especially essential funds like for drugs and medicines. I will make it my business to get the health minister to relate to the country on the exact allocation and actual fund transfer for medical procurement. Medical procurement remains one of our number one priority expenditures. In fact, every January when our financial year starts, at least under this Pangu government's watch, we make sure health and education core expenditures up in January. They're ranked in the top 3 expenditures. Number 1 expenditure is salaries. Number 2 expenditure is health. Number 3 expenditure is education. We have to pay our children's school fees. So every January, even before Connect PNG gets its share of funding, we make sure there are funds on in the till for medicines to be on the shelf. I do admit that in the structures we have sometimes structural impediments that impede, especially on disbursements to health department and the health department in terms of procedures to actually procure for actual medicines to be on the shelf. That is one of the reasons why I've been transparent. It is out on public notice already. Good guy, the current acting health secretary, but when his contract came up for review, Cabinet felt that some of these things must be relooked at again. So the current health secretary remains in job as in the acting capacity until we tally the process for leadership in the health sector. This government is cognizant to the need for health of our country not to be compromised. Lest we forget, we took office, ran straight into COVID-19. And through the travesty of COVID-19, we took the country out of COVID-19 into 2021, 2022, today 2023, 24. Despite the apparent weaknesses we carry through, we try our absolute best never to compromise the health of our people. There have been funding also. I want to relate to question number, question he put on infrastructure and especially Central Province. If I could respond, there have been funding transferred from Planning, Finance, Treasury to Health Department for health sector infrastructures. And so I have called for accountability on the spread and disbursements. Some of this funding were meant for provincial health as well as district health. It is not for spending a little here, a little there, a little neither. It has happened, and so we've asked for full investigation. All PHAs have received, in my view, in the last 3 years, over 60 million kina each, including Central PHA, on average. It may be less, maybe more. It may be less, maybe more. These are initial seed capital. If there is no plan, or if there is no land accessibility, they are work for PHAs because they are autonomous. PHAs are a creature that exists that has autonomous power. So PHAs should now, for instance, Central PHA, should have a clearest plan, groundbreaking done already. This is the site, this is the design. We've received this 30, 40, 50, 60 million kina. Mr. Prime Minister, Mr. Health Minister, where are we? 6 hospitals we want to do that are still running around in the quagmire and the sense of Wegani, and I take full responsibility. I blame no one. I take full responsibility. Health ministers come, health ministers go. They expect Prime Minister to go down and push the wheelbarrow. I make policy statements up at the top. And so, but I take responsibility. 6 hospitals. Later this month, on 31st, I will have the greatest pleasure of being in Wabek to open a 600 million kina hospital, world-class. The previous government initiated. My government put over 500 million kina of that hospital. We don't break good programs, and I give commendations to the PNC-led government. They initiated this project, just like the courthouse. They initiated the courthouse. My government put 400 million kina the last 4 years in a courthouse that is fully finished, awaiting reopening, or opening rather. And so, like the Central Hospital, I do apologize to the Central people. Intention is there. We made the announcement. The system keeps running around. And I make no secret, that's why the health secretary is not reappointed. We're not going to carry people who will not follow instructions to run through. We make policy instructions, the system should be picking up and running with this one. So Central Hospital remains outstanding. Hela Hospital remains outstanding. Southern Hospital remains outstanding. Kimbe Hospital remains outstanding. Bougainville Hospital remains outstanding. So these were hospitals that are marked to go first, and then the other balance of hospitals will run. We want to deliver 22 provincial hospitals that is sitting there to address our people's needs, and then the rest we run through. In between those announcements in 2019, 2020, 2021, this government has transferred over 60 million kina each to all the PHAs. I asked governors of the House and members like the Honorable Member for Kuiri, good question. It is within your work at the Provincial Assembly and the work of the governors to summon the PHAs. Some PHAs are working very well. For instance, ECP PHAs. They're working very well, so they assist the sector very well in that space. Some PHAs, governors, this government amended. Listening to popular cry, we amended provisions of the PHA Act so that there's a response, lateral relationship with your provincial administrators. You sit there as a chief accountable officer in the province asking PHAs, are we progressing matters? So not to take away blame from our side when the provincial hospital is not being moved. It has always remained our intention for our Central Provincial Hospital. It pains my heart to see Central Province people who've gifted this country, our nation's headquarters, to sit under tents at the side of 3 Mile. And so, Honourable Member, your question is in order, and I will check where the process is in respect to Central Provincial Hospital. Central Province deserves a hospital. When the current leadership came in, current Madam Governor, she in fact wrote to us saying that let's downgrade the provincial hospital conversation, let's build up regional district hospitals. That was a call that came from the province, but I still remain affirmative that the province does need a hospital so that Central can remain into Central Hospital. I will respond back to this Parliament and to the Central people as to the status quo of what has happened in the Central Hospital plant endeavor. But to conclude, I want to say your third question on the direction on shifting away from the procurement at the Health Department to a WHO sanctioned providers of medical supply. We cannot compromise the standard of medicine supplied. We've shown discrepancies where orders were happening on the byways and sideways of Waigani. And so we said, stop this nonsense. Let's order straight from certified. We cannot compromise our people said certified WHO medical suppliers we have here or have internationally. Now it may have become impediment. It's something within the care of a health department. I'll get the health minister to report back to the country on the status of medical supplies, where procurement is coming from. But the intention was simple, Mr. Speaker. We saw elements of discrepancies, all manners of pharmaceutical companies were popping up here and there. It was becoming a scheme and scam traditionally was. We try to put a stop to this and get it straight from where it matters on procurement of drugs from reputable and recognized suppliers so that our people's health is not compromised. That was the intention of this policy direction from my office, and it still stands. I give commitment to revisit this. If need be to improvise, we can improvise, but the improvise will not come at the expense of good medicines for our people. Thank you, Mr. Speaker. I hope the answers are sufficient. If I have not answered anything, I'll be willing to take a question in writing from the member, and an appropriate response would be rendered back in due course. Thank you, Mr. Speaker.